Quadruped is a great position that a lot of physical therapists use for a lot of different reasons. But in this video, I want to discuss how we can use it to improve mobility, and not just general mobility, specifically the upper back or the anterior chest. If we can follow these two principles, you can maximize the time that you're in this quadruped position. Before I demonstrate how to specifically improve mobility, we need to understand the 50% rule. Now, when we're in a quadruped position, we are going into protraction. The amount of protraction that we go into directly influences our results. For example, when we go into less than or equal to 50% protraction, so not over rounding, what happens is the serratus anterior on the front side of the scapula is going to bring everything towards the ribs. So as a result, posteriorly, we are going to compress, and anteriorly, we are going to expand. So this means that if we're in a 50% or less protraction quadruped position, and then we tell our patient to inhale, the air is going to move and open and push the chest and expand the anterior chest. So why would that be good, and what would we see from it? Well, if we do it correctly, we will start to see an increase in our shoulder internal rotation. Remember, after you do an exercise, you always need to then go retest and see, did it have the impact that you actually wanted it to have? So for 50% or less protraction, we should see an increase in shoulder internal rotation. This means that we did the exercise correctly. Now, if we go to the other side, 50% or more, think of over rounding here. What's going to happen here is, because we're over rounding, we're going to get expansion posteriorly, and we're going to get compression or compressed anteriorly. How do we see that compression anteriorly? Because once we get and cross the threshold, the pec, the chest, really starts to contract. That contraction is going to compress anteriorly, and the eccentric position posteriorly is going to allow it to expand. So if we go into a position and we get this, what do we expect to see when we retest? We should see an increase in shoulder external rotation. So that's the 50% rule. Let's go through some specific scenarios and demonstrations. So now we know the 50% rule, but we need to coach it in a way that actually makes sense to our patients. So to get them familiar with their 50%, their 75, their 100, we need to have them go in a quadruped position and literally just tell them to go as low as they can and call that their 0, and then for them to push up as high as they can, and that's their 100. Now in this position, usually it's pretty easy for them to recognize how to get down to about 50%. And from there, tell them to go to 75%, and then back to 100. So get them familiar by calling out different percentages so they can truly understand what protraction represents: 100, 50, and 0%. So let's discuss a scenario when you would want to use the 50% or less rule. Imagine a patient that has limited shoulder internal rotation, a tight pec, and struggles to expand the chest on inhalation. This is a scenario where we want to open up this anterior side. So to promote this, we'll go through our drill, make sure our patient starts at 0, bring them to 100, and get them down to about 50. This 50% ensures that there's not an overactivation of the pec. Why? Because if we overactivate and contract the pec, it's going to compress, and we're actually going to start to get air more posteriorly. So in this 50%, we get that serratus and the upper back muscles in more of a concentric position to hold on to that, and then all we do is instruct them to breathe. We inhale through the nose, exhale through the mouth. And what we're looking for is that chest to expand, not so much the upper back. Give this a shot the next time you have this type of patient. Now let's consider a scenario when we'd want to use the 50% or more rule. Think of a patient that has limited shoulder external rotation as well as a really tight upper back. To promote expansion back there, go through your same principles where we go from 0 to 100 and they could stay there or drop a little bit. The key here is that we actually get the pec to contract. That contraction is going to compress the anterior side in conjunction with the elongation, expansion of this upper back. Now we just have them breathe in through the nose, out through the mouth. Keep that contraction and promote and bias air more posteriorly. So I hope you found that valuable and give it a shot the next time you are doing a quadruped exercise. Now remember, the big takeaway here is getting more intentional with our position and our cueing. Ask yourself, what am I trying to achieve when I'm in this quadruped exercise? Are we trying to promote posterior expansion? Are we trying to promote anterior expansion? Once you understand that, you know exactly how much percentage you need to coach your patient through.